Okay, thanks so much. So I'm going to get right to it. Now, concussions are a very, there's a lot of attention on concussions, rightly so right now, because it's such a common problem. You can see 300,000 sports-related concussions occur per year. And while the biggest offender is football, it's not the only sport that we see concussions in. And frankly, it's not that the concussions only are occurring in young men. Young women are also getting concussions. In fact, if you look at the female athlete, they tend to get concussions more readily than men. And their symptoms can last longer. So what actually is a concussion? A concussion, the way I tell my patients, is akin to pushing the reset button on the computer. So you push the reset button, the computer goes, boo, powers down. And it takes a while for that computer to power back up, and I'm usually like cursing at it and trying to get it going, but it's not going to do anything until it's up and ready. That's what happens with a concussion. It's a reversible but clearly traumatic brain injury. It doesn't really show up on CAT scan or MRI, so diagnosing concussion can't be done by imaging or any blood test. It's a diagnosis of symptomatology. So a lot of people are saying we're seeing so many more concussions nowadays, but the attention is so focused on preventing these concussions. The helmets are better than ever. Why are we seeing these concussions? Well, one of the reasons is we're identifying them much more readily. Now, again, concussions don't only happen with a loss of consciousness. Only 10% of concussions really are associated with a loss of consciousness, so the vast majority occur without a loss of consciousness. So let's do some anatomy. So in the head, you have the brain, you have the cerebrospinal fluid that bathes the brain, and then you have blood. And those are the three things in the brain, in the head. And what I really want to show you in this picture is that the skull and the brain don't move in concert. So it's like an egg. You shake the egg, you hear the yolk rattling around. You shake the head, the brain rattles around. And it's this rattling, this acceleration, deacceleration, these rotational forces that occur in the brain during trauma that are thought to be underlying the pathophysiology of concussion. And what they've also seen by putting these accelerometers on helmets and actually measuring the forces that these young men and women undergo during play, especially during football, is that some of the most devastating rotational forces are done during a side impact. And if you look at this graph, the greatest side impacts occur in practice in our youth. So not professional, not college level, but middle school football practice is where you see the greatest side impact rotational injuries. And that was very eye-opening when I actually did one of these talks after a middle school practice, and I did the same talk I'm doing to you today. But I got a line of 5 kids after the practice asking me, is it okay that I have headaches after practice or feel a little dizzy or nauseated? It's very eye-opening. So what are the common features of concussion? Again, we said it doesn't have to have a loss of consciousness. That's LOC. But certainly poor motor coordination. Sometimes it can be associated with seizures. Doesn't mean that person is destined for epilepsy. Slurred or incoherent speech is often a physical finding that we see. You have these cognitive vacant stares or emotional lability, amnesia for the event. Often people will play the game after getting a concussion and not have any recollection of who won or lost. And sometimes these symptoms can last quite a while. Often these symptoms can resolve in a day or two or sometimes a week, but there is a subset of individuals that these symptoms can last and linger. So again, everyone understands the headache, dizziness, vertigo, lack of awareness of surroundings, but the other symptoms can be very long-lasting, and these post-concussive sequelae are what we really focus on. The one that gets the most media attention is this last one, the second impact syndrome. And that's a syndrome that occurs when someone gets a concussion as they're recovering from an initial concussion. It's very rare. It doesn't always happen. But in 50% of these cases, there can be malignant cerebral edema and death. And there's a whole cascade of events that are thought to underlie why this happens. But again, it's a very rare instance. And the more common post-concussive sequela is the post-concussive syndrome. And that's this constellation of disabling headaches, nausea, difficulty with attention, photophobia, difficulty with being in a room with high or mixed noises. And usually it can last, again, for a couple of weeks, but sometimes can last longer. And these post-concussive sequelae have led to these laws that now prohibit any return of play once a concussion has been identified until that patient has been cleared by a medical professional. And a recent law just last year, which was signed into effect, goes some steps further. But the bottom line is, when in doubt, we sit these kids out. Again, there's no CT, MRI, or blood test that can diagnose concussion, and the best identification is them saying they have a headache, don't feel well, don't feel right. And it's difficult because sometimes these are very high-end athletes, or the recruiters are there, or they just want to be a member of their team and not let their team down. So very often, they don't like to report these concussions, and very often the parents are supportive of that because they know how important the sports are for getting that individual into college or being part of a sport. So it is a difficult, social phenomenon. So what about prevention? How can we prevent concussions? Well, one of the biggest things we can do is education, like we're doing today, and educate the coaches and the parents and the teachers about what a concussion is and how to identify concussion. And also changing the way the game is played with rule changes, no spearing or leading with the head, no head-to-head contact. But what about helmets or mouth guards? They have not been shown to prevent concussions because of what I said before. It's not due to a direct impact. It's due to the shaking that occurs in the brain. So you can have the biggest helmet in the world. If that brain is being shaken inside the head, you're still going to get a concussion. So what to watch out for in the first 48 hours? It's not for concussion. We're watching out for other problems. So if, let's say, it's an unhelmeted player that got a concussion, we're worried about skull fracture. We're worried about intracerebral hemorrhage. Those are different entities, very, very rare, but can happen, often get a lot of press. But if you have progressive or new headaches, weakness on one side of the body, deterioration in mental status, that patient, that individual needs to go to the emergency room for a CAT scan. So that's when you scan. Again, we don't scan to diagnose a concussion. We diagnose something that's maybe more serious and requires an even operative intervention. So what do we do once we've identified concussion? It's just a regular concussion, nothing else more serious than that. So how do we get these kids better? Really, it's just rest. There's some theories about cocoon therapy where we wrap these kids up in a blanket or put them in a dark room, say no video games, no TV, no even reading, no social interaction. That's never been shown to be beneficial. So there's really nothing that has been shown to be useful in hastening the recovery from concussion except for just rest. And we need to just have a graded return to not just sports, but school in general. A lot of these kids are getting concussions during very critical times in their life, right before the SAT, college transcripts are coming out, essays, tests, you name it. And so they have to have a graded return, not just to sports, but to school. No time tests, having the teacher understand that they may not be performing at their best, and keep them out of school if they're having headaches, especially with attention during school. Usually you just keep them out for a day or two. And again, returning them to play is done in a stepwise fashion as well. So you start off with some light aerobic exercise, then sport-specific exercise, non-contact, then contact, then full play. And you ramp it up, and if there's ever any recurrence of symptoms, you drop them back a level. Neurophysiological testing, quite a bit is made of this. This is the impact test where they sit in front of a computer and answer a bunch of test questions or memory solving tests. I think that it can be helpful if you get a baseline test and then you get a concussion and see how the impact score drops down. But there's some problems with the test. I mean, if you can ask a 15-year-old to sit down at a computer for 45 minutes and answer a test to the best of their ability on a Saturday, good luck. So I think that it can be useful, but it has to be taken with a grain of salt. So contraindications of return to play: persistent headache, neck pain, arm or leg pain, weakness, numbness, or tingling, or greater than 3 concussions. That 3-strike-you're-out rule is fairly arbitrary, but there seems to be a genetic predilection toward concussion in some people. Some people are just prone to concussions, and it's not good for them. I think that maybe it has to do with the ratio between their head and their body, how long their neck is. That's why we see these little kids with these big heads coming with these really big acceleration-deceleration forces during Pee Wee football. So what are the long-term consequences? This is Junior Seau, if you don't know, and this is a different entity called chronic traumatic encephalopathy, where these patients who have had a long career of low-impact traumatic brain injury seem to have a development of constellation symptoms that are reminiscent of either Alzheimer's or Parkinson's, and it's a different entity than those diagnoses, but it's something that's quite a bit in the media these days about how are we going to deal with these professional athletes that do present with this. And I think that, again, it's still a minority of people who develop this, and there's some genetic factors that seem to predispose people to the development of this, but it's a very serious phenomenon that we're investigating more and more. So in conclusion, concussions are not defined as mild, moderate, or severe. We don't grade them anymore. They're defined as a traumatic brain injury. They're reversible. There's non-diagnosable by any kind of test, but really diagnosed by symptomatology, and really the treatment is rest. So I'll be happy to take any questions later. Thanks so much.